All right, yeah, welcome back. We had a little challenge with our connection. Thank you all for staying with us. We are going to continue the conversation as we ended. We were talking about some of these risk factors, yes. And so you were talking about the blood group, those that have the sickle cell.
The sickling status, yes.
Yeah.
So those with sickle cell, as I said earlier on, when they have issues like they are sick and then they have other issues, they are blood sickles. And that is only seen in sickle cell patients.
Okay.
This, when happens in their bones, they start having the pain. It can happen in any parts of their body, and then they manifest as such. And people know sickle cell people to have lots of sickness, and it is all due to that. However, if this happens in the brain, and it blocks a vessel in the brain, it's just like all the others that we spoke about. So they can cause them to have a stroke.
Okay.
So in children, sickle cell kids can actually have a stroke from sickle cell. And those who have issues with bleeding or clotting as a child, you can have a stroke. So the younger children, usually, it's not very common. But then, when they have it, they usually have an underlying condition like I spoke about, making them have the stroke. But it's not very common, but they are there.
Okay. Patrol, what kafa omo sickle cell status now obi wo ho your career. Yes. Ono so sa no ebe have any effect on him or her.
The A protects them a lot. Yeah. So it's the view, the SS, the sickle cell anemia.
But
careers for they live normally. They don't have all these crises. Yeah, SS for no. So these complications are not seen in the careers. Yes.
Oh, okay. Now, also can say you be with diabetes and also a risk factor.
A risk factor.
In the same home, how does it correspond?
So that one, how will I say, the diabetes, high sugar, say maintaining like a very high body move for a very long time. It actually affects blood vessels.
Okay.
The linings, it dim, a say no. It's na easy for vessels to say a best say. Say a say sana cholesterol issue and was some you can say is equine. Actually, we spoke about the fact that when people are diabetic now, almost complications of cholesterol issues. Say blood vessels. It's a easy for vessels no develop a form clot, a form fat deposits na a bit na a block it. So these are some of the things because so diabetics, yes, they are very prone. Their risk is very high in causing stroke, and hypertensives need DA. Most of the stroke patients are you whom baby now me hypertensives.
Okay. Yakasafa some of the symptoms. Say bia ubenye bia. Say yare bia the me pass about once there, but aside or risk factors, see any some of your family history near bia bisano. There are certain things a bit me say maybe you're on that part ubenye bi.
As I said, it's usually sudden. And now to who are risk factors now, that's won't control with BP, won't control with sugar, won't far withdraw, or you're won't show who you are. Whilst you're having these diseases and you're not taking care of yourself, you should know that you are on your way to getting a stroke. Now, when you are there, now what are these risk factors? Now you don't take very good care of yourself now. If you want to start here, I best start with headache. Headache, then you're there, headache nearby, within minutes it will happen.
Okay.
In Sanya, they be take it and when you headache 2-3 days and shed then see, sir. Say, Besisa and nature say, if you BP near Koshu. Say, if you BP, Koshu, BP name out here, and then just when you stroke. Because if you offer with Robert Mia Brenner say, but stroke Nakasa near bad, there would see started say banner, a bet twasso. But then how Albania say, who say when you stroke, and say, bones a precope. If you say, we see near we bore my precaution, we need to a sue. Precope, if you want to ask one day, ye. It's me, the thing about stroke, they say, it's me one-sided. Because of the way your blood vessels working in your brain, because baby, any basic area affected.
Okay.
And a show. Until all of a sudden, Nenaya Jojo. ana ne nsa pe adwojo ana ne nan ne nsa na adwojo ebi wo hono a ne left na adwojo ana ne right na adwojo ebi wo hono a ne ni ba ko hu ade yie ebi wo mo all of a sudden ontumi nsori osori kra se ontumi nante ebi wo hono all of a sudden no onti ya ompo sa side na stroke na ba no ebi wo hono a all of a sudden ne nim na asa achia na no achia ase ne nim achia unya all the ebi so all of a sudden ontumi nkasa ebi so mo kasa so kra enye clear ase ne kasa mu aye basa ye fe bibi slurred speech ase ne kasa ne ho nti all of a sudden ne kasa ne ho nti ebi wo hono so a all of a sudden wo kasa mo nti ase why confused ebi so hono mo ase obi a why unconscious prekope no why unconscious ni na ye signs ebetimi actually say wunya stroke.
Okay. Sanya doctor SCN no stroke no it comes at once, but some of these risk factors that she's mentioned and it's me a cause stroke no. So the phone lines are open now. You can call in with your questions and your contributions. The numbers are on your screen. Call us on 024409 3032 4409 3032 so that we could answer all your questions and also listen to any other contribution that we have. We are streaming live on Facebook at Prophet Nigel Gazy or at Hail_TV. You can also send us your contributions and your questions to that page. We are streaming live there now. Now, Doc, say obi enye bi na waba. How do we treat such persons?
Okay, obiba with stroke, presentation is different. Obi wo hon more or you unconscious. Obi so hon more you conscious. Yes, obi obeka sa so to me nkasa. Yes, obeka se bia ne nsa aso to me man ne nsa so depending on how nipa ko ne beba. Into obiba na say as or you unconscious, I say we make sure say nipa ko no onhumi ye ana say moja ne ti say obi hia nsuo, obi hia oxygen ana bibisa. Ebe stabilize o. But obana say we stable, as e bia we conscious, but just say want to make kasa wo juju ana bibisa na. First and foremost, you say see ekotwa CT scan. Very important in stroke. When you trust scanner, you intimi show. Because Makacha say you have two types of stroke. Omo send your nini esi no different.
Okay, and the other some fine no. Send your nini esi different.
So make us say back no. Blood vessels na pipe. And na back no so esi bibi esi no. Most of the time the moja pokra etimi si ano kwan. Now, so moja po na esi ano kwan a. Ope say wonanim ufa bibi etimi nanim moja. Imagine sa wodi sa mo obi a ni moja nakasa leak. Nipa kon be bleeding mo. Omo treatments ni very different.
Okay.
Into wonim which is which. Na say wo go straight obetimi cause more problems to the patient. And at the other point too no so say as I said no and I'm say different no. And e bi so on ma bibi na cause one age baby na enye stroke. Then e say we nya stroke. Yeah, stroke na very clear. But what if you say e be a brain tumor bi and e cause na bibi another form of bibi na esi sa na e cause sa. The most important thing is you have to do a CT scan. But one of the main reasons why a CT scan is say making sure say you weigh and you weigh and say it me start to say you treat it. Into one more buy say ultra CT scan. But na wo ho nya you be stabilize o first be say more oxygen and na say the nsuo bi be si wo say bo eduro bi prekopa ye be ye ne sa na am akwa kwatwa CT scan. Into kwatwa CT scan e ba ni ye hu which is which ni ye hu how a direction your management no ebeko. And then I'm say most of the time no omo nya stroke omo yare underlying conditions or BP or diabetes no cholesterol into say here investigations into say hwehwe adekra ema e cause stroke a wunya ye no BP was rana BP sem no how you handle bleeding ni BP ni different from how you handle ischemia ni BP no into na make us a CT scan is very important. In say bia na wo BP how you be handle BP we diabetes say you start to say you control it. We call it say fine wo akoma yare e say fine out so wo akoma yare na say ho no ye call wo eduro bi so eduro ni ntina e ma wo bleeding no eduro ni ntina e ma wo clot na e see ye hu na ye hu edwuma nti wo ba one na e see ye hu which type of stroke and na yare kra
A cover
by ni hu how I de wo.
Okay. Nti eno de wontimi entina fie nkasa bia ho no meduro bi.
No. Stroke I say what they call hospital.
Okay.
I say what they call hospital. And a stroke a time limit. Se stroke ni si na se yenka se clot bi na esi kwan a esi preko pa a say e kwa supply e koma a whole area but near a ben no ene na start say e wu first nti bia na ewe echi no eno no ye fa bibi ischemic pneumonia no na say e ho na yare enwu ye e say wo contem na doctors na start so mu treat anya sa those areas ni nyina ebewu wasin stroke because adrenaline is such that it controls different functions. Inti ebia na baby ketwa na ewu no, ebia na control won sape. Na nia hoso na ebia na control wo kasa, ebia control wo nan, ebia control wo adwen, wo niema. Inti wo kwantem na se ebia na yetumi so ano ntem ania eyare ni with time within 3 weeks ni na function besanya because enu enwu ye. Pre, oti enu enwu ye inti na wo kwa hospital na ntem a with time ni nyina beba back because the idea is we want to save those areas now. I said they are under threat but those cells are not dead. We want to save those areas into no stroke na time into within time those areas in now say feel say the function ko cry a be start to say baba na ka the only small area na ho no e wu pre ko pe no okay into no wo ba ntemo a e na wo chances of survival no e anya sa pe sa damage in e be permanent nia okay enwu ye na but ase aho me brass because moja ne nhye down ko yi ni nyina be start to say
okay into those parts na ebewu no it's not revivable like ntimi revive any biom
most of the time the damages say wu preko pa the damage is usually say stroke ya na aka na say ontumi na antibio the damages but the thing is we have something we call neuroplasticity. We start retraining the brain to start taking up some functions into no any physio near that we start training the brain to start relearning certain things but it take a very long time but that area no is dead
but also to me cause memory loss
now me say the brain it controls everything in the body depending on the part of the brain that is affected.
Okay.
You see, say the part of the brain they control will memory beko.
Okay.
The control will kasa beko.
Okay. It's bibia timisi.
It depending on the part of the brain that is affected. E severe enough I'll be wu. If you want to stroke no mu. I'm hospital no mu.
Not just a control or more vital organs.
If you want depending baby a one mid brain pons area no a very severe you die. If you want one whole half of the brain no depend on the part the severity of it into be wu prekope. Into know the effect into also will be how will be and it depend on the parts of the brain that is affected.
Okay. Ya share treatment methods here. Yes, also share preventive methods. Then I bet me will stay away from stroke, from developing it.
So it's about the risk factors. Now, if you are hypertensive, it's how we do make sure you control it. If you are diabetic, same. Cholesterol level, say we manage. We also say we try to lose weight. Let's say drugs, say cocaine, and say you try say you see smoking, excessive drinking of alcohol. Who jare, akuma jare. If you be atrial fibrillation, or be a hormone akuma na say valves no problems or valvular heart disease. We acquire the artificial one cranial endocarditis. There are lots of heart conditions it increases your chances. In the same way, you will show very, very well. And now we drobi so. If you are form a clot be will baby, na doctor ni wa to a drobi so. And now I say what share. You can't say hospital. I say what na doctors ni who how a drone ne work. But my old need to a dro so. Not just say we just was a warfarin. A drobi was instead so be hospital ya monitor and uncle no ati ho. A gene same wo betimi akose harm. These are some of the things. But then there's something about stroke I would want to talk about. The treatment, the thing about hospital main medical treatment, but then there are some things we need to do for stroke patients.
Okay.
That's how I would like to talk about.
All right.
Obinya stroke will fear your money is you.
Your money is you.
Your money diani.
Your money.
Yeah, you say we didn't call hospital first. If you won't name me out, if you want no man, ni swallow we no problem about. What for some man to me many obe choki. or the ebe me aduane na akɔ ne lungs mu.
Okay.
Na mana akɔma ne infection na ne yare na yɛnhu ano no ekonya chest infection aka ho na worsen ɔmo situation. Te wonim ɔmo nim stroke fo wo fi ne bi wɔ hɔ no ma yɛ de tube a show mu nhwini mu a ɛkɔ ɔmo yɛ mu a yɛde aduane fam. Bi so ɔmo yɛ connect mu ɔmo yɛ phone direct sankɔfo no ɔmo swallowing reflex asɛe. Intine that is how yɛ ma ɔmo didi yɛ de tube ɛne yɛde feed ɔmo. Wonim sɛ wo relative na wenya stroke no ne deɛ ne saa na ɛbɛyɛ sɛ wo force ma ne nsuo ɛbɛkɔ ne lungs because ɔntumi mmene. Na stroke patients ɔmo nursing no ɛyɛ very very important. Ɛyɛ sɛ wo dane ɔmo. Nipa da faako a yɛ obibi yɛfrɛ ne pressure areas. Sɛ wɔn dane na ɛhɔ ne bɛyɛ kuru. Instead of obi wɔ fie na sɛ ɔntumi nante a wobɛhwɛ na ɛsɛ ne toa ayɛ kuru na yɛkyi ayɛ decubitus ulcers. Because of that, into stroke for the name so maybe moon to me movie or mono. Or no more, I say, or more adane very, very important. Or more cleanliness, so very, very important. Also, a bed na, and more munya infections, and more munya sauce near dear. Oh, and now into a more feeding, a dear, everything is very, very, or more depressed most of the time because mia me de me ho me koba. And then means me and combine no be na so me depression. Nti I say any relatives near there no omu to me encourage you omu emu set the same cry omu ye nipa omu ho won faso to deal with all those because depression is seen when so consequences so you die on and so ho no. And a physiotherapy.
Okay.
Because we have to retrain the brain. And the earlier you start the physio, the better for the brain. In stroke for early physio, as much as possible, within 3 to 7 days, you should start physio for stroke patients so that the brain will start, trying to relearn and then redevelop itself very, very. We go on and the speech, no problem. We have something we call speech therapy. We have occupational therapy. There are lots of things that we can do for stroke patients. Okay, that can be done. You have to speak to your doctors about it. Try and find a way. The fact that somebody has a stroke is not the end of their life. You have to find a way of redeveloping the brain and know how to take care of them. And yes, depression, infection,
Okay. Doc, please, could you tell us how long treatment could take?
It could take months to years.
Months to years?
For the whole thing, because actively no ebi as a BP issue and the enye de be control na wonu wedro diabetes ebe ma wedro provided a has be control but damage na aba no brain part na problem aba ho no se part na enwu ye na si etimi save na within 3 weeks to 3 months so be say no the functions ni na eba because no ye hu ni ntem ye save ni ntem. But baby, you will not prep. We want me to make up.
Okay.
Especially say 1 year hoshia. If you saw my what started say we any physio kakra. It takes time. Within 2 weeks, we won't say all of a sudden it be a first no. Want me moving in and be aware no sorry no you see poma no they come kakra. If you want my first want to me feed you better knows on how to me so spooning. If you want my initial want to me many idea or she you better now all of a sudden no or to me many a bedu baby no ni ye. Instead taking it depending on the extent of the damage, it depending on the part how like the situation or how dire it is, the part of the brain and the damage na is and how early you start your rehabilitation, your physio no. How early you take your patients to the hospital, how early you start your rehabilitation, and the extent of damage will all tell you how long this will take. Most of the time, most of the time. What's in American? Yeah.
Okay. Right. We've been speaking to Dr. Josephine Awotwe. She's a medical officer at the Rema Ralpha Medical Center. And I believe that you found this very helpful. She had said a lot. And of course, it's going to help you to take control of your health because your health is your wealth. So it means that if you know you have some of these risk factors, make sure that you take abrupt attention. Make sure that you are taking particular attention and you are taking your medicines as the doctors have prescribed. And doc, me patrol, you've been exercising. I know that exercising is a crucial aspect to this whole. Maybe now person control your cholesterol. How many times in a week should you exercise?
Minimum 3 times. Like if you do minimum, that's what I'm saying, maybe 3 times in a week, at least within those 3 times. Maybe I will jog, or if you are going to the gym, however you are going, minimum 3 times. Some people, those who are really into it, some people do it daily. But at least if you want to really go into exercise and then probably try to lose weight, 3 times a week minimum should be fine. Yes.
All right. Next month is October, which is the Breast Cancer Awareness Month. She's got a package for all of us. Let's listen to her. Doc, please tell us about your activities for next month.
Okay, so as we all know, October is the breast month, the breast cancer awareness month. Yes, it's the month for women. So there's going to be a huge free breast screening for all women in Accra. There are going to be 4 of them in 4 different areas in Accra. It's going to be on Saturday, different venues. 1 in Tema, 3 in Accra. We'll give you free breast screening.
Free, oh.
Free.
The underlined word is free, so
we would give 40% discount on breast ultrasound and mammogram. And what are those? Anytime you have an issue with your breast, your doctor will ask you to do either a scan or a mammogram, depending on your age. We are giving you 40% discount so that you can go ahead and then do this, and then we can take the condition a bit further. Now, after you have done your scan or your mammo, we will give you free consultation, because we want to make sure that the women that we find having issues are taken care of. We don't want a situation say you say in your hospital, na nipa kwa na anko hospital, yeah, you say to ye ho so. Say wo be ye screening no, ni ye hu bibi wo no phone mu a. Yeah, you be more discount. Until we betimi akwa scan na say wo ye no, wo koye wi a results no. Yeah, you be more free consultation on the results. And from there, we can give you appropriate referral to the places where the definitive management said just a final thing they see a year now hotel and no need a more appropriate referral, the right hospitals to go to see. No one share a honor music, the whole day. There will be free Wi-Fi. Opa bet now na be browsing the whole day. Be streaming on the internet. There will be a little bit of something for everyone. We'll come back again. We'll tell you all the venue and then the time. The next time you're on set. So watch out for it and then be part of it.
Thank you very much, Dr. Josephine. Please, let's take advantage of her kindness. She has decided to be good to us. Make sure that you take advantage of it. Go there and have your breast screened. Don't go only for the Wi-Fi. Definitely go there and have your breast screened. There's Breast Cancer Awareness Month. Doc, please, we have a question from Facebook. Let's attend to it before we go. Our time is up. But somebody, Anita is asking that can a long-term family planning case cause stroke in women?
Okay, so oral contraceptives have been documented according to research that they can cause stroke. Oral contraceptives taken for a very long time, in some cases can cause stroke. Yes.
All right. Thank you all for watching the show, and see you same time next week. You can contact Doc. Doc, please tell us how to contact you.
Okay, so please, you can follow me on Instagram, the Dr. Josephine on Instagram. You can send me all your questions. You can follow us on that page so that you get all the details concerning the breast cancer screening. And then, if you want to speak to me for consultation, you have to call me through 247 Doctor online. So you can download the app or call them, check them on Facebook or Instagram, get their contact, call them, ask for Dr. Josephine, and then you get to speak to me for consultation.
All right. So thank you so much for watching the show. My name is Sandra Bentil. You can also follow me on Instagram at the Sandra Bentil. So if you have any contribution or any question that is unanswered, you can send it to me, DM it to me, and the next time that we come, we are going to talk about it. Thank you so much. Keep on watching Hill TV. And so on behalf of the entire production team, have a nice evening. And don't forget, keep on watching Hill TV. Prophetic 360 is up next with Prophet Nigel Gazy. Good evening.
Hill TV proclaim. bitawa uwana Baby ama yanyofe cry What I sense for share and from a share Your baby are not near me Had your grandma just so yummy near everyone's side So to me on a mess of me I'll be back Don't you know Bema to send me near dream I see Near dream I see
In Jesus Christ.